Hi, this is Dr. George Rogu from RBK Pediatrics. Primary care when you want it, urgent care when you need it. Today I'd like to speak to you about the COVID-19 vaccine. As everybody knows, Pfizer just announced that they're dropping their age to 12 years and above. We're getting a lot of phone calls from parents asking us various types of questions, so I decided to put this little PowerPoint together to let parents know what they need to know about the COVID vaccine. This presentation is based on information that we got from the CDC COVID-19 response and vaccine task force. It's adapted for pediatrics. So, unfortunately, as we see it happening today, we have a lot of fear and disinformation. It's all over the place. It's on Facebook, it's on Google, it's on the news, it's on the radio, it's everywhere. You can't escape it. Unfortunately, a lot of people that spread this information are not medical professionals. Some of the misconceptions that I've heard from people is as follows. You can catch COVID-19 from the vaccine itself. Or only young people took part in the trials of the COVID-19 vaccine. Some mentioned that minorities are not included in the trial. I've heard silly things such as the mRNA vaccines are untried technology. It can alter your DNA. It can cause infertility. And, you know, the list of silly things that I hear goes on. And the most interesting one was we're going to be microchipped. That's really out of this world, because if you think about it, who wants to microchip us? You're already microchipped with your iPhone. The reality about the vaccines is the mRNA vaccines are over a decade old already. Some of us may have already received some type of vaccine. The studies that they did with these types of vaccine was from a diverse population of people. You cannot catch COVID illness from the vaccine. It does not alter your DNA, and it certainly does not cause infertility. Now, some things that we know about COVID-19. COVID-19 is an infection with a virus that can result in a wide range of illnesses. Some people suffer with mild illnesses, some have severe illness, and even death. What is also known is that everyone is susceptible to this infection. And we don't know how this virus affects every person. And in my clinical practice, I've seen people walk around with positive tests, and they have absolutely no symptoms. And I've seen some sick children, not deathly ill, but just some sick young adolescents where they've been just fatigued and tired for a longer period of time. But, you know, the overall result with all the pediatric patients is that all the children, they do very, very well. The people that we do know that get really extremely ill with this COVID virus is older adults greater than 65 years of age and certain people with medical conditions. It is unfortunate that about 1% of Americans infected with COVID-19 will die. We also learned over this past year that some things help to prevent the COVID-19 disease. Wearing a mask certainly helps. The mask has also helped in eliminating the flu, strep infections, and many other general pediatric illnesses. Avoiding close contact with others, especially those that are ill with the disease. If one avoids touching the eyes, nose, and mouth with unwashed hands, if you clean and disinfect your hands frequently, common sense stuff, washing your hands, soap and water, alcohol-based sanitizer, the list goes on and on. But it's just simple common sense, good hygiene helps to prevent the disease. Now, the new things that help to prevent a disease is vaccinations. Now, vaccinations are not new technology. They've been around for ages, and I'm in a generation of physician that had seen a lot of medical childhood illnesses in the past. Fast forward 20 years, a lot of these diseases have been, relatively eliminated because of the vaccines. measles, mumps, rubella, chicken pox, whooping cough, different types of meningitises. They're just gone. They're pictures. Younger physicians, they've never even experienced a lot of these illnesses, only in textbooks. Now, why should a person get vaccinated? Well, it is a good idea to protect yourself and your family from the disease. It helps to prevent the spread of the illness in the community. It will help to open up the schools. And if everybody gets vaccinated, we will return to life a little bit faster. And it is the fastest way to end the need to wear masks in all social environments. And the truth of the matter is, vaccines historically work. Now, everybody, I get questions from parents, are the COVID vaccines safe? In the United States, when they come up with a vaccine, safety is the utmost priority in all analysis of vaccines. The side effects that are experienced with vaccines generally occur within the first 6 weeks of the vaccination, but to be extra cautious, the FDA requires 8 weeks of monitoring on the COVID-19 vaccine. And the monitoring for the safety of the vaccine continues as it is distributed to the public. In general, to assess the safetiness of a vaccine, the FDA typically advises that there was a minimum of 3,000 participants in the trial. In the current COVID-19 vaccine trials, there were over 30 to 50,000 participants, and many multiples of millions of doses have already been administered across the country. Another question that I receive is, how effective is a COVID vaccine? Well, we do know that the COVID vaccine is pretty darn effective. The Pfizer one is 95% protection from having an infection, and the Moderna, the vaccine that I had received, is 94.1% protective against having the disease. And the efficacy is similar across all races, ethnicities, and ages. Now, I believe that the COVID vaccine does work because a few weeks ago, my son, my college student son, 21, came home with positive COVID, had been a little bit sick. He came home, went to sleep, was really, really fatigued and tired, slept basically from Friday until next Thursday. He would get up in between to have some food, to shower, and to do some of his online classes because he was sent home from college. Now, my wife, who never had the COVID illness, but did receive the Pfizer vaccine, as a mother, would go into his room and check and see how he's doing. Is he breathing? Because we were afraid that he had asthma, could trigger an asthma attack, and so forth. And she went in his room many, many times, and truthfully, many times without a mask. Stayed in his room, stayed by his bedside, cared for him a little bit. And COVID, she didn't get sick with COVID. And she had her vaccine before Christmas this year. So I believe it works. Now, like I said, the new measures for prevention of COVID disease is the vaccines. There are multiple types of vaccines in development, but the ones that are commonly used and will be used in pediatric medicine are the Pfizer and the Moderna vaccines. They are both under the FDA's emergency use authorization. And this is a process that's used to help facilitate the availability of vaccines and medications to distribute to the public during public health emergencies such as the pandemic. But the COVID vaccines are being held to the same safety standards as all vaccines. And they did go through the different types of phase clinical trials, phase 1, 2, 3. Now, to explain the phase of clinical trials, when somebody comes up with an idea to give a vaccine, it is called phase 1 trials. This is where they get about 20 to 100 healthy volunteers, and researchers try to answer the following question. Is the vaccine safe? Are there any serious side effects? How does the vaccine dose relate to any side effects? And is the vaccine causing a positive immune response in people? After they pass that, they go to phase 2 clinical trials. This trial has several hundred volunteers, and the researchers try to answer the questions: what are the most common short-term side effects from the vaccine? What is the body's immune response to this vaccine? And are there any signs that the vaccine is protective? In other words, does it work? After that passes, they move on to phase number 3, 1,000 plus volunteers. They try to figure out how does the disease rates compare between people who get the vaccine and those who do not. And we also try to figure out how can the vaccine protect people from the disease. Once that's all done, they move on to phase 4 where the vaccine gets approved. And the researchers try to answer the questions where the FDA approves the vaccine only if it's safe and effective and the benefits outweigh the risks. And researchers also continue to collect the data on the vaccine's long-term benefits and side effects. So with the Moderna and the Pfizer vaccine, we got up to phase 3. And slowly we're going to get to phase 4. The reason they gave the EUA approval was because it is the fastest way to get a vaccine out to the population in a short period of time. But that doesn't mean that any shortcuts were taken. Like I said, phase 1, 2, and 3 were already completed before they started administering to the population. And the FDA, the EUA determination was based on whether the vaccines were likely to have more benefit than risk to people. And when the EUA is authorized, the manufacturers can begin deploying the vaccine, but they must continue to collect data to submit for phase 4 trials. Now, the regular way, the long way, is pathway 2, is where the manufacturer files for full FDA approval. This is a complicated way. The application is reviewed by the FDA Center for Drug and Evaluation and Research, then independent committees of physicians, statisticians, pharmacologists, chemists, scientists review all the data. The FDA commissioner makes a final approval, and then advisory committees get involved. ACIP, which reviews all the data, makes a recommendation on how to use the vaccine, which populations to give it to, and the schedule. The ACIP also recommends the ages which the vaccine should be given, number of doses, and the time interval between, and precautions and contraindications. This phase 4 administrative process can take many years to complete. So when we say that the vaccine came out pretty fast, they just eliminated, all the administrative red tape. Now, when we came out with the vaccine, it was starting to be distributed across the population. They gave it to the healthcare personnel first because they were the ones that were in the front line, basically in contact with people that are sick with COVID-19. So they were at the highest risk, and they had their hierarchy of people, the people that worked in the hospitals, in the emergency room. A week or two later, then they opened it up to regular doctors such as myself in their different offices, and then they started to get the seniors and people with chronic conditions. And then as more and more of the population is vaccinated, the requirements are less and less because you cannot produce millions upon millions of vaccines in a very short period of time. You're going to get some, and then they're going to ramp up the production over time. Now, why should we trust the COVID vaccine? We should trust it because the FDA used the same strict standards that it has for decades, and no steps were skipped. The research was already done. The only thing that they did was condense the administrative steps in the process. They also had 2 independent advisory committees which reviewed the results. We had experts in the committee, and these experts have no conflict of interest, and they're not associated with any vaccine manufacturers. The Vaccine and Related Products Advisory Committee advises the FDA on what to do, and the ACIP is the one that advises the CDC what to do. Now, the EUA, Emergency Use Authorization, was based on the need to use the vaccine quickly in order to save lives during a public health emergency. If you think about it, how many people passed away of COVID-19? They only wished that they were able to get the vaccine before they got sick. The EUA was a shorter process. No steps were skipped, however. And the FDA will continue to assess the vaccine with known potential benefits outweighing the potential risks. And in no way does EUA mean that any steps were skipped. Now, how was that the vaccine was developed so quickly? Now, that's very simple. The major reasons why these vaccines were developed so quickly was because it was a global effort with the world's leading scientists focused on one single task, getting the COVID vaccine. We had unlimited resources from money, knowledge, manpower, and technology. And we had a large, vast, diverse adult volunteer for the trial participants. Now, there are two types of vaccines, and both are messenger RNA-related vaccines, Pfizer and Moderna, and they do not contain the COVID-19 virus. Now, the mRNA COVID-19 vaccine technology is not new technology, as some people would say. This technology in vaccine production has already been used in cancer treatment. It's vaccines. It can be included in vaccines such as rabies, Zika virus, cytomegalovirus. They all use the same technology. It's been studied for more than a decade already. How it works is that the COVID-19 vaccine gives instructions for our cells to make a harmless piece that looks like that spike protein on the coronavirus. The spike protein is found on the surface of the COVID-19 vaccine, on the virus. So our bodies recognize that this protein should not be there. They build antibodies to it, and they remember how to fight off the virus that causes COVID-19 when the body becomes infected in the future. And the vaccine cannot give you COVID-19, and it does not change your DNA. Now, another question that comes around is, how long will I be protected by this vaccine? Most of the vaccines are 2 doses, usually about 3 to 4 weeks apart. The best protection occurs 1 to 2 weeks after the second dose, because when you get a vaccine, it builds up your immunity, and then you lose some of the immunity, and then you want to get a booster dose to build up your immunity even further. We certainly don't know how long this vaccine will be protective once we receive it, but we will know more as time passes and research continues. Will this vaccine become an annual vaccine? I almost guarantee it. It's going to end up being like a flu vaccine. I want to repeat, people tell me that they're afraid to get COVID-19 because of the vaccine. Well, you can't get the COVID-19 because of the vaccine. Once you get the vaccine, however, you can expect to have some short-term discomfort at the injection site, some fatigue, headache, muscle pain, chills, fever, pain at the injection site. Usually lasts about 24 to 48 hours. And the symptoms seem to be a little bit worse after the second dose. My personal experience has been when I had my first dose of the Moderna vaccine, I felt like a little achy for a short period of time, but nothing really. The second dose I got about 8 or 10 hours later. I felt a little tired, a little achy, maybe a little chills. I just basically went to sleep. And by morning when I woke up, everything was gone. And having the COVID illness last year in April, I said it felt like COVID disease, but just a milder form of it. And I guess the side effects, as they say, it means that your body's doing a good job of making antibodies, and that's a good thing. These side effects are considered normal, and they're expected. The most common side effects, fever, fatigue, headache, muscle pain, just like with many of the other vaccines that we give. Now, what should people expect when they get the COVID vaccine? You should always expect to get a second dose, because the single dose will not protect you. And you have to always get the same vaccine. You can't get a dose of Pfizer and then get a dose of Moderna. They're not interchangeable. You have to get 2 of the same one. Now, some other information that I get from people, they say that if I get the COVID vaccine, I may get a positive COVID test. Well, that's not really true. I had a case where a young adolescent patient received her COVID vaccine about a week ago, Pfizer. Then she comes to the office with some chills, aches, pains, fevers. Sounds like COVID. I did a COVID rapid antigen test in the office, and it was negative. I did the strep, the flu, the routine, all negative. Because I was a little leery of this because of the COVID vaccine, I said, let me do a PCR test on her. And sure enough, her PCR was also negative. So she got her vaccine and her COVID test did not turn positive. There is the possibility, however, that if you get the vaccine, if you do the antibody test, it may show an immune response giving you a positive antibody test, which basically gives you a level of protection against the virus. And that's what you want to happen. The biggest thing that people say about the COVID vaccine is, if I get the vaccine, why do I still have to wear the mask? Well, you're going to have to wear the mask because it's going to take a while for us to develop herd immunity. So for the immediate future, you do need to wear the mask. But as time passes on, these restrictions will be modified. And like with other vaccines, you need to have a large number of people to get vaccinated before the transmission drops enough to eliminate the need for masks. And they're already saying that if you're vaccinated, you don't need to test anymore, you don't need to quarantine anymore when you travel. They're saying that if you have your vaccine in outdoor spaces where you can socially distance, you don't need to wear the mask. They're allowing you to go to venues and events like ball games if you have the vaccine. So getting you the vaccine gives you a little bit of the ability to get back to some normalcy to life. Now, is it safe to get the COVID vaccine after you've had COVID? Even though you had COVID and it does give you some kind of immunity to the illness, you should still get the COVID vaccine because it'll give you better protection against the disease in the future. The one thing that you should try to not do is to get it immediately. You have to wait a few months before you get the vaccine. Now, the best thing to do is get educated about it. And where should you find some accurate information? Well, the best place to get it is from your physician. Stay away from social media, the news. It's full of misinformation and opinions based on misinformation. The CDC has great resources. Now, vaccines are the only way to control the pandemic. And ending the pandemic will require herd immunity, which will take time. Herd immunity is only achieved through a combination of infections, recovery from the infections, and vaccinations. So everyone should get vaccinated in order to get back to normal life. Thank you very much. So this is just a little summary of the COVID-19 vaccine. We're hoping to get this in the office. We right now have the Moderna vaccines for 18 and above, and our office was authorized to get the Pfizer vaccine for 12 and above. We're looking for the immediate future to be able to begin some COVID vaccine clinics for our young patients. Thank you. This is Dr. George Rogu from RBK Pediatrics.